and exhale and inhale, but it's virtually impossible to detect it unless you have a particularly strong odor in your breath, such as onions, because your own nose is accustomed to the odor that's either inside the nose or the mouth.
Right.
You know, because the source of bad breath is really your own mouth or your nose because of sinusitis. So the only way that one person can tell if somebody else tells you. So you got to be neighborly and friendly.
Well, let's talk about some tips on how people can combat this issue.
Okay, it has a lot to do with mouth hygiene. So the cause in the vast majority of people, about 75%, is bacterial overgrowth or overgrowth of various organisms in the mouth. And the source of these, where these organisms live, really is the tongue.
Okay.
So you want to physically cleanse the tongue at least twice a day, and if possible, after each meal. So you either take a tongue blade or your fingers or any other implement to lightly brush off the tongue. Now, that doesn't mean you need to reach all the way to the back of your tongue and be rough with it, because that'll cause injury to the tongue and further potentially increase the bacteria there. So keep the tongue clean, and if the source is your nose due to sinusitis, see your doctor and get some medications to clear up the sinuses to allow it to drain.
So when I'm brushing my teeth, would you use your toothbrush, or?
You can use your toothbrush if it's soft, or use a gentler implement like the side of the tongue blade, which won't cause as much injury to the tongue. So it's really important to cleanse your tongue. And of course, another issue is bad breath in the morning. And you know, that's difficult. You got to go ahead and brush your teeth and really, most importantly, cleanse the tongue.
What about mouthwashes?
Mouthwashes certainly help because they're antibacterial. You don't want to use the mouthwash immediately after brushing with a toothpaste, because the soap in the toothpaste counteracts what the mouthwash has. But the mouthwash is a good idea. And one other tip is chewing gum. One of the causes of the bacterial overgrowth is that we don't have enough saliva. Certain people don't have enough saliva in the mouth. So when they chew gum, you produce more saliva, and it allows the mouth to minimize the amount of bacteria.
So if you have a friend with bad breath, offer them a stick of gum.
That's right.
All right, thank you very much, Dr. Vijay. Remember, Dr. Vijay is here Sunday to answer all of your medical questions. So if you have a topic you would like us to discuss in the future, shoot us an email at news